Do you ever wonder what is an appendix? The appendix is a small, tube-like structure attached to the large intestine, located in the lower right side of the abdomen. It's considered a vestigial organ, meaning it no longer serves a vital function in the body, though some scientists believe it may play a minor role in immune function or serve as a reservoir for healthy gut bacteria. Despite its small size and seemingly insignificant role, the appendix can become a serious health risk if it becomes inflamed, a condition known as appendicitis. Appendicitis usually occurs when the appendix becomes blocked. This blockage can be caused by hardened stool, foreign bodies, tumors, or infections that cause the tissue to swell. Once blocked, bacteria inside the appendix can multiply rapidly, causing the appendix to swell, become inflamed, and fill with pus. If this condition is not treated quickly, the pressure inside the appendix builds up, and blood flow can be cut off. Without blood flow, the tissue begins to die, and eventually, the appendix may rupture or burst. A burst appendix spills infectious materials into the abdominal cavity, leading to a life-threatening condition called peritonitis, which is the inflammation of the lining of the abdominal cavity. In some cases, a ruptured appendix can also lead to the formation of abscesses, pockets of infection that form around the burst appendix. Preventing appendicitis is not always possible, as the exact causes are not fully understood and often unpredictable. However, some steps may help reduce the risk. Eating a diet high in fiber, which includes plenty of fruits, vegetables, and whole grains, may help promote healthy bowel movements and prevent blockages that could trigger appendicitis. Staying well hydrated and maintaining a healthy digestive system may also contribute to a lower risk. However, even with these precautions, appendicitis can still occur suddenly and without warning. Treatment for appendicitis depends on the severity and stage of the condition. The most common and effective treatment is surgical removal of the appendix, known as an appendectomy. This surgery can be performed in two main ways. Laparoscopic appendectomy is the less invasive option, where small incisions are made and the appendix is removed using a camera and instruments inserted into the abdomen. This method usually results in less pain, quicker recovery, and minimal scarring. In cases where the appendix has ruptured, or if there's widespread infection, open surgery may be necessary. TIA involves a larger incision to allow the surgeon to clean the abdominal cavity and remove the appendix safely. In some cases, especially when the appendicitis is mild or caught very early, doctors might try to treat it with antibiotics first, especially if surgery poses a high risk for the patient due to other health conditions. Antibiotics can sometimes resolve the infection and reduce inflammation, avoiding immediate surgery. However, even in these cases, there is still a chance that appendicitis could return, and many patients eventually undergo surgery to permanently eliminate the risk. Overall, a burst appendix is a medical emergency, and prompt diagnosis and treatment are critical. With modern surgical techniques and antibiotics, recovery from appendicitis is usually quick and complete, especially if the appendix is removed before it bursts. For more interesting videos, subscribe and comment down below.